Heartburn is a burning sensation that one might feel in the throat or chest area, usually after eating certain foods. Heartburn is one of the symptoms of acid reflux disease. The top of your stomach has a muscle called the lower esophageal sphincter. Optimally, it acts as a one-way valve that allows food to enter but nothing to escape. When the lower esophageal sphincter opens when it shouldn't, acid can come back up the esophagus, causing the burning sensation. When this happens repeatedly, acid reflux disease becomes a problem. Reflux becomes a disease when the symptoms start causing impediments to a normal lifestyle, and when the pain is chronic, severe, and over a prolonged period of time. If acid reflux happens occasionally, it is a normal occurrence and isn't usually a cause for concern. Not only is the burning sensation from acid reflux disease uncomfortable, but it can also cause other serious medical complications. For example, if acid reaches the throat, it can cause a sore throat. If acid reaches the teeth, it can cause the enamel to dissolve. The good news is that acid reflux disease is treatable and controllable. What contributes to acid reflux disease? Perhaps one of the biggest culprits is diet. Overconsumption of fatty foods, chocolate, caffeine, and alcohol can cause acid reflux. Smoking can contribute to acid reflux disease, as can pregnancy. Obesity can also be a culprit. Pregnancy and obesity increase the pressure in the abdominal area, which could push the contents of the stomach back into the esophagus. Some people who suffer from acid reflux disease have slow digestive systems, their stomachs empty into their intestines slower than normal. If left untreated, acid reflux disease can affect the esophageal lining. The acid can cause ulcers and can make the esophagus narrower, which can make swallowing foods and liquids challenging and painful. As well, the cancer risk in the esophagus increases. Untreated, acid reflux can last several months, if not longer. To treat acid reflux and symptoms such as heartburn and indigestion, antacids are often used. Antacids work to neutralize the acid in the stomach. However, antacids aren't recommended for those who suffer chronic heartburn. To alleviate some of the symptoms, you can make some changes to your routine. For example, eating 5 or 6 small meals per day, instead of 3 large meals, can help alleviate symptoms. This will allow your stomach some room to digest your food and reduce gastric pressure. Eating slower also helps. Eating right before going to bed can amplify acid reflux. Try refraining from meals or snacks for at least 2 hours before bedtime, including drinks. As well, if you nap during the day, it might be better to sleep in a chair. Lying down after a meal can increase the pressure in your stomach and increase the chances of acid reflux.